whatever you say. Recorded.
Right, ready to go? All right, good morning everyone. Hang on, take the mask off. All right, good morning Queensland and good morning Logan. It's wonderful to be down here at the Logan Entertainment Centre, and as we said, we want to see the vaccination rates increase, and we have identified Logan and Caboolture as one of the first two areas we would like to see increased vaccinations. So it's wonderful to be down here today, of course with Dr Young, Yvette, the Treasurer, Minister de Brenny, and of course Linus, the local member. So it's fantastic to be here today. So our excellent news today, I think everyone knows when I've got a smile that means it's good news, is Double Donut Day. So well done everyone. That's absolutely great news, and I'm absolutely delighted every morning when I hear that news. So well done Queensland, keep up the good work. We've got a long way to go, and we need to make sure that everyone is doing the right thing. And you can see behind me there's queues of people coming out to get vaccinated. So please put your name on the list, register. We got an extra 90,000 people that registered overnight. We now have 190,000 on our booking requests so far. Don't forget, you can still go and see your local GPs as well. You can book into your GPs, but we want to see the Queensland vaccination rates increase. And of course, we'll be updating people as we expand these centres. And also too, don't forget, we've got small planes flying around Queensland as well, going to those remote and rural areas and making sure that people right across Queensland are getting vaccinated. And we have the most decentralised state in the nation, and I just want to applaud everybody for the coordination that's happening. So we still have 1,800 people in home quarantine. A big shout out to those families that are still doing home quarantine. Thank you, thank you. You are keeping Queenslanders safe, so well done there. We've done 14,336 tests over the last 24 hours. If you have any symptoms, it's absolutely vital you go and get tested. By going and getting tested, you are keeping Queenslanders safe. Don't sit at home and go, oh, this is just a cold. If you have any symptoms, go and get tested. We've got to always find that very first case. So that's excellent news that we've got people coming out and getting vaccinated. And the Logan Entertainment Centre where we are today, they have done a great job. They've done 33,144 vaccinations since the 5th of June this year. They're doing between 1,300 and 1,500 per day. It's the second largest vaccination hub outside of the Brisbane Convention and Entertainment Centre. And by the end of September, we want to ramp this centre up down here to do 3,000 per day. Now, the other shout out I want to do, and we're going to be here with some of our fantastic multicultural leaders of Queensland, and especially in this area. We need everyone to get vaccinated. So I'm doing a big shout out to all of our wonderful multicultural groups as well, that I want you to come forward and put your name down and do the right thing as well and get vaccinated. We've seen in parts of Melbourne and of course in Sydney where there have been some slow uptakes from our multicultural communities getting vaccinated. Well, we're going to make sure that definitely does not happen here in Queensland. We have a proud multicultural state, and through our leaders we are going to be through social media and through the television and radio and paper networks, we are going to do a great campaign to get every Queenslander vaccinated. So I will put out a big shout out there. If you're sitting at home and you're thinking, should I or shouldn't I get vaccinated? The answer is yes, yes, yes. We need everyone in this state that can be offered a vaccine to get a vaccine. All right, so with those few words, I'll hand over to Dr. Young. Thanks. Thanks, Dr. Young.
Thank you, Premier. So fantastic news today. No new cases in Queensland, none in the community, neither the Indooroopilly cluster nor the Cairns cluster, so that is excellent, and none in hotel quarantine acquired overseas, so that's really good. But there are still 1,800 people in home quarantine, and any of those could end up with the infection. So thank you very much. This must be extraordinarily tough for you. You're going through a very long quarantine process because people have become positive in your household, and then you have to start your quarantine all over again. So thank you very, very much. You are keeping your community safe and the whole of Queensland safe. We know that it could just take one case of Delta, as we've seen in New South Wales, to end up with thousands of cases. So every single person who might be infected, we need to ensure that they remain in quarantine. So thank you very much for that. Then the other thing we need to do to protect ourselves and the whole community of Queensland is get vaccinated. And this is a fantastic centre. The only thing I'm sorry about is my daughter used to come here every year for ballet concerts. I love this centre. It's so well set up, and I can see why it makes such a perfect vaccination centre. The sooner we can get everyone vaccinated, the sooner we can put centres like this back to their normal use, and that will be really exciting. But this is so important. Please, if you're 60 years of age or older, go and see your GP if you haven't already and get your first dose of AstraZeneca. Now you should wait 12 weeks to get your second dose because that gives you better protection, and we're not currently in an outbreak in Queensland. I'll make sure to let you know when we might have to bring that back again to 8 weeks. At this point in time, it's 12 weeks for that second dose, unless your GP thinks otherwise, so talk to your GP about it. If you're age 16 through to 59, you can, of course, go and see your GP, you can go to a pharmacy, or you can come to one of our Queensland Health vaccine sites. Now, it's really important to go on and register and then put a booking in place. That's critical, and thank you to all of those Queenslanders who have recently been registering, and we'll get through all of those quickly because we're increasing the doses. Now, there is another group that's important. That's 12 to 15-year-olds with severe underlying health conditions, and our Children's Hospital is facilitating that to make sure that those children, their parents know that it's important they get vaccinated. So it's not the general population. These are really specific children who need to get vaccinated to protect themselves, because if they were to get COVID, they could have potentially very severe disease. And then the last one I want to talk to, because someone reminded me of the importance of this, thank you, is pregnant women. So early on, you would have seen the advice was if you were pregnant to delay vaccination. That advice has totally changed, totally flipped on its head. Now they are an absolute priority group. So any woman who's pregnant, please, please, please come forward and get vaccinated, because we know if you get infected, you will do much worse than someone of your own age who isn't pregnant. So if you're planning pregnancy, if you're breastfeeding, if you're pregnant, doesn't matter, please get vaccinated, because it will not only protect you because you're immunocompromised, it'll protect your baby. So it's really important. Just like flu, we always say if you're pregnant, it's more important than anyone else to come and get vaccinated. Same with COVID. If you're pregnant, very, very important that you come and get vaccinated. Thank you.
Zero new cases today. We're so proud of every Queenslander and the efforts you've been making throughout this entire pandemic that has kept us safe. But of course, we cannot be complacent. We need to make sure we keep up that good hand hygiene, the social distancing, the mask wearing, the testing, and getting vaccinated. So if you are from one of our multicultural communities, if you're an Aboriginal or Torres Strait Islander person, if you're an elderly person and you've already had your vaccine, ask your friends and family, have they been vaccinated? And if not, why not? Let's keep everyone safe. Let's make sure we encourage our loved ones, our friends, our family, our neighbours, our work colleagues to go out and get vaccinated. This is what will help keep Queenslanders safe, and we want every Queenslanders safe. I want to give a big shout out to our amazing health workers who are doing vaccinations right across this state. As the Premier said, we have a very large decentralised state, and we are flying vaccines right across this state. We are putting them in planes, we are putting them in boats, we are getting vaccines to people every way we possibly can. And just this morning I heard that in Lockhart River up in far north Queensland, when they went into that community with those vaccines, 87% of eligible people 16 and older turned out and got vaccinated. 87%. So well done to Lockhart River. But let's not make sure that they're the only ones getting those figures. Let's beat that number and get out and prove that we can get our vaccination rates in every single suburb, in every household, in every community. We can get those really high rates of vaccinations. As the Premier said, here at Logan, we're doing around 1,500 a day, our second largest vaccination site in Queensland. I want to thank everyone for the great work they're doing. I know that we're working very closely with our multicultural leaders to bring people here to Logan Entertainment Centre, but of course we want to get the vaccines out also more broadly to the communities around Brisbane, around southeast Queensland and across Queensland, and also working with our other vulnerable groups. Please make sure that you are coming out and getting vaccinated. And also, as we have said every day, and I'll continue to say, if you have any symptoms, no matter how mild, please come and get tested. Just because we're seeing 0 cases does not mean that this virus won't make its way into our community again. New South Wales, ACT, Victoria and now New Zealand are seeing a growing number of cases. It could be in our community any day now. Please get out, get vaccinated and keep coming out and getting tested if you have any symptoms whatsoever.
Thank you, Deputy Commissioner, then the Treasurer.
Thank you. Good morning. If I could start with our borders, yesterday we did see an increase in the number of vehicles coming across, so 6,478. Pleasingly, we turned around nearly 200 less, so down to 317 yesterday. But still, too many people trying to get across the border that simply do not have the exempt purpose to do that. Please check before you come that you're entitled to do it. Also, for those persons that are able to come across, question whether you really need to make that trip. So just because you're authorised to come in doesn't mean you should. So think about that. Overall enforcement was very good yesterday, so only 4 on-the-spot fines, 2 of which were border breaches, only 1 mask breach, although we ran an operation on the Gold Coast yesterday specifically targeting masks, and we had to hand out 190 masks in the community. That is a little disappointing. So overall, 267 masks handed out across Queensland yesterday to every community, including the Gold Coast. Take your mask with you, carry it, and wear it when you should. We will continue to focus on that and run some of those sort of focused operations as we go forward. And a final shout out to our businesses who again are doing the right thing. So 67 checked yesterday and no breaches at all. Thank you.
Well, good morning everyone, including everyone watching online, including our Facebook friends. And I also want to welcome today some more friends, friends of mine from the Woodridge community. Some fantastic leaders from the Aboriginal and Torres Strait Islander community, leaders from our Asian community, including leaders from Cambodia and Pakistan, leaders from our African community, including leaders from Eritrea and also from Burundi, leaders from our Pacifica communities, including elders from the Samoan community and elders from the Maori community. All here today united with the Premier, the Health Minister, the Chief Health Officer, my parliamentary colleagues from Logan, Mick de Brenny and Linus Powell, all with a single message: please get vaccinated. We see the terrible events that are unfolding south of the border, what's happening in New South Wales. And the freedoms we're enjoying in Queensland at the moment are denied millions of Australians. They are denied to millions of Australians because of this terrible and wicked virus. And the single biggest way we can fight back against COVID is to get vaccinated. And I want to thank all of these leaders who've done such a wonderful job during the pandemic, keeping people connected, letting people know that they're not alone when we were separated. They've done a wonderful job, and now they're leading the way, getting their community vaccinated. As the Premier said, we need to be vigilant about this. Complacency is our enemy when it comes to COVID-19. Vigilance and urgency, they are our greatest weapons. We've got to stay urgent. We've got to stay urgent when it comes to protecting our community, keeping our borders strong, taking the health advice every single day, wearing our masks, and of course getting vaccinated. The record here at the Logan Entertainment Centre has been absolutely out of this world. Of all of the appointments that have been made here, they've been complied with. We've had people turning up 99.5% of the time. We've only had 0.5% of the appointments that have been booked here, of all those appointments, unfilled. And that just shows you how Logan is responding to this pandemic. But as the Premier said, we need to do more. I'm so pleased that the government will be ramping up the number of doses here in the Logan Entertainment Centre for vaccination. We'll be doubling that by the end of September. And I know that the people of Logan and southeast Queensland, they will be rolling up their sleeves. They will be putting their arm forward for that important jab to keep themselves, their families, their communities, to keep our businesses operating, to keep our economy going. That's the key. That's the key to fighting back against COVID. And I want to thank my friends for being here today, for everything they've done. And we'll continue that fight against COVID to keep our community protected and to keep Queensland safe.
Thanks. We're happy to take some questions. So the police have been in discussion, the Deputy Commissioner's been in discussions with the Australian Defence Force about just helping with our borders as they did previously. So those discussions are going extremely well, and hopefully, fingers crossed, we'll see some reinforcements on our border in the coming weeks.
Does that needed to free up the police to go back to normal operations?
No, they helped out last time, and I think that'd be great if they could help out this time. So the request has been sent, and we're just waiting for a formal response. But we're hearing that it's being is being considered favourably. No, they've been down there before. They've helped out, and I think it's great to see. So, you know, this is a clear, like I said yesterday, a clear and present threat to Queensland, and we need those reinforcements there to keep our borders safe. And that's why we have this magical window here at the moment, Queensland, to go and get vaccinated. As soon as we get more supply from the Commonwealth, we will put those supplies into the arms of Queenslanders. And that'll help keep Queenslanders safe and also to help protect our Queensland lifestyle.
Big gathering of businesses on the Gold Coast today as well. They're very frustrated with the army being flagged and going there, and the rhetoric.
But the army's been there before.
Absolutely.
Yeah.
The rhetoric as well is
Yep.
actually causing Queenslanders not to go there to Gold Coast when they need it with the border closed. They've invited you again to talk to them down there. What can you say to them?
Well, what I can say is New South Wales has issued the order to stay at home. That is the directive that New South Wales has issued to those communities that live across our border. And as Dr. Young has said very clearly, it only takes one person with that virus to bring it into Queensland, and then all bets are off. So I'm making no apologies for keeping Queenslanders safe, and the sooner that New South Wales gets on top of the issues, the sooner we can go back to some sort of form of normality in our lifestyle. So, look, it is tough at the moment, and you know, no one wants to see businesses suffer. No one wants to see that. But the stay-at-home order has been issued for New South Wales residents, and that's what New South Wales residents need to do to get on top of that virus. If that virus comes into the southern parts of the Gold Coast and into the Gold Coast, there will be a lockdown on the Gold Coast, and I don't think businesses would want to see that. So, look, it's a very tough situation at the moment, but everything we are doing is to keep Queenslanders safe.
Do you reinstate the border bubble at the moment in Northern New South Wales LGA to come out of lockdown, or is there a little bit of a period there where you have to maintain that?
Look, at the moment, New South Wales has a stay-at-home order for the entire population of New South Wales.
Are there many essential workers who need to cross the border who wouldn't have their first jab, and what's being done to make sure that they do?
So yesterday the Health Minister talked about how Broadbeach has been stood up to actually get people their first doses if they are an essential worker. We've got people coming here today at Logan who are essential workers. They can come here and get their first dose as well. These measures are being put in place to protect Queenslanders. Jess, I don't have the full list here with me at the moment. We are narrowing that list down because the more people that cross the border, the increased risk to Queenslanders. It is going to be a very narrow list, So Dr. Young has tasked the head of my department across Premiers and Cabinet to work with all the other agencies. Later on today, we'll be also speaking to our industry alliance to let them know why these measures are being put in place. This is about safety. And as Dr. Young said, it only takes one person to cross that border with Delta and all bets are off.
There's been some complaints that people are having trouble getting appointments because they work different hours or whatever. Is there any move to extend hours further or go to 24-hour vaccination?
If anyone has an issue getting a vaccine, they should contact Queensland Health if they are an essential worker, and they will be prioritised to get that vaccine.
Not looking at extending hours further.
Well, not at this stage, but we will work with them to make sure they can get their vaccine. My figures today are 44% have had their first dose of eligible people for the vaccine, and 22% have had their second dose. If we get more supply from the Commonwealth, we will ramp up. We have the capacity to ramp up, and that's exactly what we will plan to do. But we need that additional supply from the federal government. And like I said, this is this window of opportunity now to get more jabs into more arms. And my plea today is to people from multicultural communities to come out and get your vaccination as well. There may be some hesitancy out there. We've got some great leaders of our multicultural groups here today. We'll be talking to them later and getting that message out to Queenslanders to come forward and get that vaccination. What we've seen in Sydney, what we're hearing has happened in western parts of Sydney, is that when people went and visited different homes, the virus was spread, and then in shopping centres and then through their hospitals. So what we need to do is get as many Queenslanders vaccinated as possible.
Are you looking to do anything like they have in Sydney, where they've had vaccination clinics put up at community centres?
Yes, we're absolutely looking at all that. When we get the extra supplies, we'll be able to roll out those plans, and all those plans are being formulated at the moment. We are looking at school halls, we are looking at community centres, we are looking at mobile vans going out and about into communities as well. But for us to do that, we need the supply.
Are you ordering any more AstraZeneca for the vaccine?
The GPs have the AstraZeneca. Don't forget, the federal government has recently approved Moderna, so Moderna will be coming. Our pharmacists have AstraZeneca as well. So we're going to be getting those extra supplies, and we will be ready to go. As soon as we get those supplies, we will be ready.
When you say bringing the army in earlier wasn't about freeing up police resources. We've had officers calling messaging radio stations this morning, talking to journalists about stations being under-resourced. I know that was hit on the head yesterday, but is that a genuine issue at the moment at some point?
I'll get the Deputy Commissioner to look at that. But of course, once you do get extra bodies on the line there at the border, it would free up some police capacity. But we've worked together with the federal government on this before. This is not new, guys. This is not new. They've helped and assisted before. So,
Specifically on the under-resourced police stations.
well, we've also got a lot of people going into hotel quarantine at the moment as well. A lot of people coming in from interstate, having to go into hotel quarantine. You know, we've got our health resources. They're doing vaccines as well. They're doing testing. I mean, this is a situation that's happening across the nation. It's not unique to Queensland.
On crime, Ian Lever says today children who use weapons should be sentenced as adults, and if they commit crime on bail, they should automatically be locked up. What's your reaction? I know your lordship.
Yeah, we've put in tough laws, and we were criticised by introducing those laws. Some people said they were too tough, so those laws need to take effect. But of course, we are concerned about juvenile crime, very concerned about the recent home invasion that happened, and hopefully these new laws, that the magistrates will definitely take into account those new laws and keep the trouble people off the streets.
And then what changes are required? Or are you measuring?
We put in a suite of new laws. We put in over $500 million, the largest injection ever. And we will continue to work with the police union, we'll continue to work with the youth organisations. You know, we want to stop the cycle of crime, And it is very disappointing to see what happened a few nights ago.
Wouldn't consider those specific.
Not at this stage. Not at this stage.
Some kids who were part of the Indrapilli cluster, now that they're back at school and recovered, are
Yes.
unfortunately reporting that they're being bullied by other kids.
Well, that shouldn't happen. Look, we're happy to look into that. I'll talk to the Education Minister about that. That definitely should not happen. It is unfortunate how that the Indrapilli cluster happened, but this could happen anywhere. You know, we could see, and we expect to see, cases that will pop up from time to time, and our job is to get on to it as quickly as possible. And thankfully, when we were presented with a person who tested positive, we acted very quickly. So I want to thank everyone for that.
We would like to, on behalf of the multicultural leaders here, to thank you and the committee, and especially those who work so hard day and night, you know, trying to prevent the COVID-19 to come to our states, because everybody's jealous of us and they wanted to get in. Now what I wanted to know is, about 2 days ago you requested that the border be moved a little bit down so that we can help those who are very close.
That's right,
to us.
yep.
Yeah, what is the response from New South Wales?
Yeah, so look, we sent that letter away. I understand that they're considering that letter. So we'll wait to hear, but my concern now is it could be getting too late. So look, we'll wait to hear. I think hopefully we'll hear by close of business tomorrow, but we were trying to keep those communities together in that sort of border bubble. Yep. Sorry? Well, time's ticking. So we're seeing an escalation of cases in New South Wales, and that's very concerning.
And has there been any, the other day there was some numbers around the level of people crossing the border who have been vaccinated. Has there been a change in that at all?
Look, we'll probably be able to get an update for you on that tomorrow. Yeah. Okay, thanks everyone.
Dr. Young,
Yep,
about
sure.
just with the children
Yeah.
who've recovered from COVID and are back at school, just
Yeah.
to be clear to that school community, is there any risk to the community once you've recovered from COVID?
I think the school should put in a process. They have assemblies. I know my kids were at school where they honour people who've been academically excellent, sporting excellent. They should honour these children. These children and their families were amazing in what they did. I genuinely did not think we would manage that cluster within the 8 days. By any measure out there, we shouldn't have been able to. So it's due to those children and their families that we succeeded. So they should all be applauded for what they did. There is no risk. They have fully recovered. There is absolutely no risk to anyone in that school or anyone in the community. I can assure you, we keep people in isolation till that risk is gone. So those children were absolutely safe to go to school, and they should now be thanked for what they've done.
Dr. Young, can I just ask again on your message to pregnant women?
Yes.
About the research overseas. What has that shown us about it being worse for pregnant women to get COVID and the safety of being inoculated?
Yeah. So initially, of course, with any trial, pregnant women are not part of that trial. So the plan for any trial for a new drug or a new vaccine is you first start with healthy adults, then you move on to adults who have underlying health conditions, and then later you start looking at special groups like children and pregnant women. So those trials weren't done initially, which was why the recommendation was not to vaccinate pregnant women. Then the trials happened, and also a lot of women got vaccinated because they didn't know they were pregnant. So, and it showed that there was absolutely no risk to the mother or to the baby or to the fetus or to the baby after the baby was born. And now, unfortunately, we are starting to see evidence that pregnant women, because of their immunosuppression that we know occurs during all pregnancy, because they're carrying that fetus, so their immune system is dampened down, if I can put it like that, that they, if they get COVID, do a lot worse than someone who is the same age who isn't pregnant. So that's why it's critical that pregnant women get vaccinated.
And Dr. Young, if I could just ask you too, one of my earlier questions, re-essential workers, where's your mind at in terms of whether farmers, people who grow food, can, cross the border into their own properties and
Yeah.
continue to?
So I've spoken to the Director General who's responsible for that area as late as last night, and he's working that through because there are different scenarios, and so they are identifying each individual person, because for some people, of course, there's no risk. Their property just happens to lie both sides of the border and they stay within it. For others, there's significant risk. So he is working that through for every single person to make sure that where they do need to travel, they can, and that they're able to access the vaccine, and where they don't need to travel but can wait, then they don't.
On the mask law changes tomorrow, do teachers and childcare workers who can't social distance still need to wear masks, or does it go back to the initial?
No. Teachers, all teachers need to wear a mask. So for those teachers that have to be able to communicate with, the little preppies or with deaf children, they can wear a shield. So that's already in place. But otherwise, for another week, all teachers need to wear a mask indoors. And then all students, grade 7 or above, so high school students, still need to wear a mask indoors.
Okay, thanks everyone. Thank you. Thanks.
Thank you, Peter.
Oh, thank you. I can
It's
do
been
this.
a long time, huh?
Yeah, how's it going? Thanks.
Good. Yourself?
Good, good. Thanks for coming out, everyone. So
Thank you.
we'll have to
Thank you, Dr.
do
Young.
some messages.
Well done. I always see you on television every day, but I
Everyone's
never saw
coming.
you in person. I told you.